Hello, my name is Dr. Chet Nastala, and I'm one of the surgeons here at PRMA Plastic Surgery. We specialize in breast cancer reconstruction, and although we use autologous tissue or the body's own tissue to do reconstruction the majority of the time, we also are able to offer implant reconstruction. And I wanted to talk to you today about some of the common misconceptions that patients have about DIEP flap surgery. I often hear that flap reconstruction is associated with more postoperative pain than implant reconstruction. Well, many studies have shown recently that implant reconstruction may be associated with a higher level of pain in the recovery period than DIEP flap reconstruction. And some of the reasons for this include our new enhanced recovery after surgery protocol, whereby we inject numbing medicine into the abdomen to provide pain relief after surgery. DIEP flap reconstruction can be considered a soft tissue reconstruction. We're not taking the structure of the abdominal wall, we're taking the outer layers of the skin, fat, and the blood vessels, and oftentimes the sensory nerves, so we're able to reconstruct a soft, natural breast mound, and the pectoralis muscle is not stretched out over an implant or a tissue expander. So this may explain why implant reconstruction is associated with a higher pain level than flap reconstruction. Another common misconception is that DIEP flap surgery has a higher rate of complication than implant surgery. Patients feel that it may be a more complex procedure and therefore there may be higher complications. And while there certainly can be complications of the donor site involving wound healing issues, especially in patients who are diabetic or have other reasons why they may not heal very well, implant reconstruction may be associated with a higher rate of infection or ultimately losing the implant if the implant becomes infected because of the fact that there is a foreign body. Our flap reconstruction is associated with 1% or less flap loss rate. Many of my patients that I see over time who've had flap reconstruction, I will see at 2 years, 5 years, 10, or even 15 years out, and the breast will age with time and usually does not change very much. That's not the case with implant reconstruction. Typically, over the course of several years, you'll develop a capsule around the implant, which may certainly be soft for some time, but it's unpredictable when and if that capsule would begin to harden, become firm, or show visible ripples or other signs of contracture. Implants are not designed to last a lifetime, although we would like to see them last a lifetime. Oftentimes they need to be changed out at about a 10-year interval. So what happens with implants is they're likely to degenerate with time, especially over the long term, and may require replacement. Another common misconception about DIEP flap surgery is it's associated with a long hospital stay versus an implant. Typically, our flap reconstruction patients now can go home as early as post-op day 2 or usually day 3 because of the enhanced recovery protocol. This compares favorably with implant reconstruction, in which the patient may stay for 1 or 2 days following mastectomy and tissue expander reconstruction. Another common misconception is that DIEP flap surgery can be performed by any surgeon or at any hospital. And I think it's important to make sure that you verify that the team has a sufficient experience in DIEP flap surgery. Number one, that the surgeon is board certified in plastic surgery by the American Board of Plastic Surgery and has additional experience or expertise or training in microvascular surgery. You should also verify that there is a sufficient number of procedures performed each year to make sure that there's sufficient experience in both the operative team and the surgeon, and also that the hospital is accredited and has a low complication rate. It's also important to verify that the group has an excellent success rate, hopefully greater than 99%, flap success rate with a less than 1% flap loss rate. I think if you can satisfy all these requirements, then you can be comfortable in your choice of reconstructive surgery team, and that you're making a good decision, a well-informed decision. At PRMA Plastic Surgery, we believe that deep flap breast reconstruction represents a state-of-the-art in terms of breast reconstruction because it affords a soft, natural breast mound, which is the patient's own tissue and generally improves with time. It has a relatively low complication rate and it can be performed safely in most patients.